First, I will be performing the anterior drawer test. The patient is seated in a relaxed position with the ankle off of the table. The athletic trainer will place one hand on the tibia to stabilize it, as well as another hand on the posterior calcaneus. The foot will be in a neutral position, so in between dorsiflexion and plantar flexion. And the athletic trainer will pull the calcaneus anteriorly as the tibia stays forward. A positive sign for this test will be if pain is felt in the lateral malleolus, or the ATF ligament, or if pain is felt in one ankle versus another. This signifies a sprain of the anterior talofibular ligament. Next, I will be performing the Kleiger's test for the deltoid ligament. The patient is relaxed in a seated position with the ankle off of the table. The foot is in a plantar flex position. The athletic trainer's hand is on the tibia, as well as another hand in the midfoot, and the foot is rotated to eversion. A positive sign for this test will be if pain is felt near the deltoid ligament, or if pain is felt greater on one ankle compared to the other. And if there is pain felt, then this signifies a sprain of the deltoid ligament. Next, I will be performing the Kleiger's test for distal ankle syndesmosis, which is performed exactly like the previous test, except for a few differences. The hand of the athletic trainer will be on the anterior fibia, as well as the midfoot, but the foot will be in dorsiflexion, and then will slowly be rotated to eversion. If pain is felt near the distal ankle, or greater pain is felt on one ankle than the other, then this is a positive sign for a high ankle sprain. Okay, this is the talar tilt test for the anterior talofibular ligament. The patient will be seated in a relaxed position, and the athletic trainer will place their hand on the anterior tibia as well as the calcaneus, and the foot will be in a plantar flex position, and it will be slowly rotated into inversion. A positive sign for this test means if there's pain felt near the lateral malleolus, or if greater pain is felt on one ankle versus another, then there's a positive sign for an anterior talofibular ligament sprain. This is the talar tilt test for the calcaneofibular ligament, which is located on the side of the ankle. This test is performed just like the previous test. The anterior tibia is held by the athletic trainer, as well as the calcaneus, but this time the foot is held in a neutral position and then rotated to inversion. If pain is felt in the CF ligament, or if more pain is felt in one ankle compared to another, then this signifies a sprain in the calcaneofibular ligament. The third test is the talar tilt test for the posterior talofibular ligament. This test is also performed just like the previous two tests, with the athletic trainer's hand on the front of the tibia, as well as on the calcaneus, except the foot is in dorsiflexion and is rotated to inversion. If pain is felt near the PTF ligament, which is located on the back of the ankle, or if pain is felt greater on one ankle compared to the other, then this signifies a sprain in the posterior talofibular ligament.